Outcomes for breast cancer vary depending on the cancer type, the extent of disease, and the person's age. The 5-year survival rates in England and the United States are between 80 and 90%. In developing countries, 5-year survival rates are lower. Worldwide, breast cancer is the leading type of cancer in women, accounting for 25% of all cases. In 2018, it resulted in 2 million new cases and 627,000 deaths. It is more common in developed countries and is more than 100 times more common in women than in men. Different diagnostic tests help to diagnose and detect breast cancer early. Diagnosis of breast cancer. To determine if your symptoms are caused by breast cancer or a benign breast condition, your doctor will do a thorough physical exam in addition to a breast exam. They may also request one or more diagnostic tests to help understand what's causing your symptoms. Tests that can help diagnose breast cancer include 1. Mammogram. Annual mammograms are recommended for women age 45 and older, but you can begin screenings as early as 40. A mammogram is an X-ray that only takes pictures of the breasts. These images help doctors identify abnormalities in your breast such as masses, which could indicate cancer. 2. Breast ultrasound. An ultrasound is a test that uses sound waves to produce images of the inside of your body. Ultrasounds help doctors determine whether a lump or mass is a fluid or a solid. A fluid-filled mass indicates a cyst, which is non-cancerous. Some masses can be a combination of fluid and solid, which is typically benign but could require short-term follow-up imaging or even a sample depending on what the ultrasound image looks like. To perform a breast ultrasound, your doctor places gel on your breast and uses a handheld probe to create an image of your breast tissue. 3. Breast biopsy. A biopsy removes a sample of tissue from a lump or mass to determine whether it's cancerous or benign. This is usually an outpatient surgical procedure. The doctor performing the procedure inserts the needle into your breast and removes a sample piece of tissue. This may be done with or without imaging guidance depending on your doctor's recommendation. You may need a surgical biopsy in certain circumstances. This removes all or part of the lump. The surgeon may also remove any enlarged lymph nodes. These biopsies together form the gold standard for tissue evaluation. 3.1. Fine needle aspiration biopsy. This type of biopsy is used when the lump is solid. The doctor inserts a thin needle and retracts a tiny piece of tissue for study by a pathologist. In some cases, the doctor may want to examine a suspected cystic lump to confirm that there is no cancer in a cyst. 3.2. Core needle biopsy. This procedure involves using a larger needle and tube to extract a sample of tissue up to the size of a pen. The needle is guided by feel, mammography, or ultrasound. If a woman has a finding best seen by mammogram, then a mammogram-guided biopsy will be done. This is also known as a stereotactic breast biopsy. 3.3. Surgical, or open, biopsy. For this type of biopsy, a surgeon removes part, incisional biopsy, or all, excisional biopsy, wide local excision, or lumpectomy, of a lump for evaluation under a microscope. If the lump is small or hard to locate by touch, the surgeon may use a procedure called wire localization to map out a route to the mass prior to the surgery. A wire can be inserted by ultrasound guidance or mammogram guidance. 3.4. Sentinel node biopsy. A sentinel node biopsy is a biopsy from a lymph node where cancer is most likely to spread first. In the case of breast cancer, a sentinel node biopsy is usually taken from lymph nodes in the axilla, or armpit region. This test is used to help determine the presence of cancer in the lymph nodes on the side of the breast affected by cancer. 3.5. Image-guided biopsy. For an image-guided biopsy, a doctor uses an imaging technique such as an ultrasound, mammogram, or MRI to create a real-time image of a suspicious area that can't be easily seen or felt through your skin. Your doctor will use this image to help guide a needle to the best spot for collecting suspicious cells. Analysis of these biopsies can help your doctor determine the grade of your cancer, the tumor's features, and how your cancer will respond to certain treatments. 4. Breast MRI scan. A breast MRI scan isn't a typical screening tool for breast cancer because of its higher risk for false positives. But if you have risk factors for breast cancer, as a precaution your doctor may recommend MRI screenings with your annual mammograms. This test uses a magnet and radio waves to produce a picture of the inside of your breasts. Tests to stage breast cancer. After you're diagnosed with breast cancer, the next step is identifying your stage. Knowing the stage is how your doctor determines the best course of treatment. Staging depends on the size of the tumor and whether it has spread outside your breast. Cancer cells that spread to lymph nodes can travel to different parts of your body. During the staging process, your doctor may order a complete blood count and perform a mammogram of your other breast to check for signs of a tumor. Your doctor may also use any of the following tests to determine the extent of your cancer as well as to assist with diagnosis. 1. Bone scan. Metastasized cancer can spread to the bones. A bone scan allows your doctor to check your bones for evidence of cancerous cells. 2. CT scan. This is another type of X-ray for creating detailed images of your organs. Your doctor may use a CT scan to see if cancer has spread to organs outside of the breast, like your chest, lung, or stomach area. 3. MRI scan. Although this imaging test isn't a typical cancer screening tool, it's effective for staging breast cancer. An MRI creates digital images of different parts of your body. It can help your doctor determine whether cancerous cells have spread to your spinal cord, brain, and other organs. 4. PET scan. A PET scan is a unique test. Your doctor injects a dye into your vein. As the dye travels through your body, a special camera produces 3D images of the inside of your body. This helps your doctor identify the location of tumors. Breast cancer treatment options by stage. A variety of treatments for breast cancer exist, and treatment is available at every stage of cancer. Most people need a combination of 2 or more treatments. After diagnosis, your doctor will determine the stage of your cancer. They will then decide on the best treatment options based on your stage. 1. Stage 0, DCIS. If precancerous or cancer cells are confined to the milk ducts, it's called non-invasive breast cancer or ductal carcinoma in situ, DCIS. Stage 0 breast cancer can become invasive and spread beyond the ducts. Early treatment can stop you from developing invasive breast cancer. 1.1. Surgery. In a lumpectomy, the surgeon removes the cancerous cells and spares the rest of the breast. It's a viable option when DCIS is confined to one area of the breast. A lumpectomy may be performed as an outpatient procedure. This means you can go home shortly after the surgery and won't need to stay in a hospital overnight. A mastectomy is the surgical removal of the breast. It's recommended when DCIS is found throughout the breast. Surgery to reconstruct the breast can begin at the time of the mastectomy or at a later date. 1.2. Radiation therapy. Radiation is a type of targeted therapy. It's usually recommended after lumpectomy for stage 0 breast cancers. High-energy X-rays are used to destroy cancer cells and prevent them from spreading. This treatment can lower the risk of recurrence. Radiation therapy is typically administered 5 days per week over the course of 5 to 7 weeks. 1.3. Hormone treatment or targeted therapy. Your doctor may recommend a hormone treatment if you've had a lumpectomy or single mastectomy for estrogen receptor positive or progesterone receptor positive breast cancer. Oral hormone treatments, such as tamoxifen, are generally prescribed to lower your risk of developing invasive breast cancer. Hormone treatment may not be prescribed for women who have had a double mastectomy for stage 0 breast cancer. Your doctor may also recommend trastuzumab, Herceptin, a targeted therapy, if your breast cancer tests positive for excessive HER2 proteins. 2. Stage 1. Stage 1A breast cancer means the primary tumor is 2 cm or less and the axillary lymph nodes aren't affected. In stage 1B, cancer is found in lymph nodes and there's no tumor in the breast or the tumor is smaller than 2 cm. Both 1A and 1B are considered early-stage invasive breast cancers. Surgery and 1 or more other therapies may be recommended. 2.1. Surgery. Lumpectomy and mastectomy are both options for stage 1 breast cancer. The decision is based on the size and location of the primary tumor, personal preference. Other factors such as genetic predisposition. Biopsy of the lymph nodes will probably be performed at the same time. For mastectomy, reconstruction of the breast can begin at the same time if wanted, or after additional treatment is completed. 2.2. Radiation therapy. Radiation therapy is often recommended after surgery for stage 1 breast cancer. It may not be necessary for women older than 70 years, especially if hormone therapy is possible. 2.3. Chemotherapy and targeted therapy. Breast cancer that's negative for estrogen, progesterone, and HER2 is called triple-negative breast cancer, TNBC. Chemotherapy is almost always needed for these cases because there's no targeted treatment for TNBC. Chemotherapy may also be given for hormone-positive breast cancers. Herceptin, a targeted therapy, is given along with chemotherapy for HER2-positive breast cancers. Your doctor may also recommend other HER2 targeted therapies, such as Perjeta or Neurlinks. However, chemotherapy isn't always needed for early-stage breast cancer, especially if it can be treated with hormone therapy. 2.4. Hormone therapy. Doctors may recommend hormone therapy for hormone receptor-positive breast cancers, regardless of tumor size. 3. Stage 2. In stage 2A, the tumor is smaller than 2 cm and has spread to between 1 and 3 nearby lymph nodes. Or, it's between 2 and 5 cm and hasn't spread to lymph nodes. Stage 2B means the tumor is between 2 and 5 cm and has spread to between 1 and 3 nearby lymph nodes. Or it's larger than 5 cm and hasn't spread to any lymph nodes. You'll probably need a combination of surgery, chemotherapy, and one or more of the following: targeted therapy, radiation, and hormone treatment. 3.1. Surgery. Lumpectomy and mastectomy may both be options depending on the size and location of the tumor. A modified radical mastectomy is a removal of the breast, including chest muscles. If you choose reconstruction, the process may begin at the same time or after cancer treatment is complete. 3.2. Radiation therapy. Radiation therapy targets any remaining cancer cells in the chest and lymph nodes. It's often recommended after surgery. 3.3. Chemotherapy. Chemotherapy is a systemic therapy to kill cancer cells throughout the body. These powerful drugs are delivered intravenously, into a vein, over the course of many weeks or months. There are a variety of chemotherapy drugs used to treat breast cancer, including docetaxel, taxotere, doxorubicin, adriamycin, cyclophosphamide, Cytoxan. You may receive a combination of several chemotherapy drugs. Chemotherapy is particularly important for TNBC. Herceptin is given along with chemotherapy for HER2-positive breast cancers. Your doctor may also recommend other HER2 targeted therapies, such as Perjeta or Neurlinks. 3.4. Hormone treatment. After all other treatment is complete, you may benefit from continued treatment for hormone-positive breast cancers. Oral medications such as tamoxifen or aromatase inhibitors may be prescribed for 5 or more years. 4. Stage 3. Stage 3A breast cancer means that the cancer has spread to 4 to 9 axillary, armpit, lymph nodes or has enlarged the internal mammary lymph nodes. The primary tumor may be any size. It can also mean the tumor is bigger than 5 cm and small groups of cancer cells are found in the lymph nodes. Finally, stage 3A can also include tumors greater than 5 cm with involvement of 1 to 3 axillary lymph nodes or any breastbone nodes. Stage 3B means a breast tumor has invaded the chest wall or skin and may or may not have invaded up to 9 lymph nodes. Stage 3C means cancer is found in 10 or more axillary lymph nodes near the collarbone, or internal mammary nodes. Symptoms of inflammatory breast cancer, IBC, are different from other types of breast cancer. Diagnosis may be delayed since there's usually no breast lump. By definition, IBC is diagnosed at stage 3B or above. Treatment. Treatments for stage 3 breast cancers are similar to those for stage 2. 5. Stage 4. Stage 4 indicates that breast cancer has metastasized, spread to a distant part of the body. By this stage, the cancer is no longer curable. Breast cancer most often spreads to the lungs, brain, liver, or bones. Metastatic breast cancer can't be cured, but it can be treated with aggressive systemic therapy. Because the cancer involves different parts of the body, you may need multiple therapies to stop tumor growth and ease symptoms. How to effectively treat this stage? Depending on how advanced your breast cancer is, you'll probably have chemotherapy, radiation therapy, and hormone therapy, if you have a hormone receptor-positive cancer. Another option is targeted therapy, which targets the protein that allows cancer cells to grow. For HER2-positive cancers, HER2 targeted therapies may include Herceptin, Perjeta, Neurlinks, Curable, or Kadcyla. If the cancer spreads to the lymph nodes, you may notice swelling or enlargement of your nodes. Surgery, chemotherapy, and radiation can be used to treat cancer that spreads to the lymph nodes. The number and location of tumors determines your surgical options. Surgery isn't the first line of defense with advanced breast cancer, but your doctor may recommend surgery to treat spinal cord compression, broken bones, and single masses caused by metastasis. This helps relieve pain and other symptoms. Other drugs used to treat advanced stage breast cancer include antidepressants, anticonvulsants, steroids, local anesthetics. Good news for all the unfortunate patients with breast cancer. Immunotherapy is an emerging treatment. Immunotherapy is a relatively new treatment option, and while it hasn't been FDA approved for breast cancer yet, it's a promising area. There are several preclinical and clinical studies that suggest that it can improve clinical outcomes for people with breast cancer. Immunotherapy has fewer side effects than chemotherapy and is less likely to cause resistance. Immunotherapy works by raising the body's natural defenses to fight off the cancer. Pembrolizumab is an immune checkpoint inhibitor. It's a type of immunotherapy that has shown particular promise in the treatment of metastatic breast cancer. You can rest assured that breast cancer is completely curable if detected early and treated properly. Note: the next video healthcare will help you learn risk factors that increase your chances of getting breast cancer. Signs of breast cancer recurrence. Factors influencing breast cancer treatment. How to control, prevent, effectively breast cancer. We invite you to watch. Thanks.